to break it down easy for you, you have two basic systems, the government one and the private one. And the basic system, like the government system, that's really only there for treatment for illness or treatment for significant illnesses, because then there's a German law, of course, in Germany, always bureaucratic, and there's a paragraph in the social law. Then it says treatment is only for getting you faster to work again. So it's not for your health or for your being well. It's just for you have to work faster because your illness is a little bit better.
So just for understanding, the government healthcare system is like the bare lowly minimum of healthcare you can get. That's there in Germany, without any add-ons. Okay, so that's like the bare minimum to get you working again.
Yes, and they pay for everything, of course, but they only pay for the lowest basic thing there is. So I don't know, if you go to the doctor and you have a cough, then of course it's not a very hard illness. It doesn't make any difference if you go to a private doctor or if you go to the doctor and you're in the government system. The big differences are coming if you have heavy high illnesses or diseases that's not like a cough, it's like more than cancer or things like this. Then there's a huge difference because the government only pays the basic ones that you don't die, basically, and the private one pay everything there is. But of course there are some negative sides we talk about later. But yeah, that's the main system. You go to the doctor that you don't die.
Yeah.
So but everything is covered until then. So you have I don't know, cancer or something like this. Of course you go to the hospital. You don't have to pay anything. Not for staying in the hospital, not for the doctors, not for the medicine, not for the treatment. So that is all covered. But only the basic one.
To understand. At the beginning, everyone is in a public insurance.
Yeah,
right?
and that's a big difference to other countries too. You have to be in any insurance. It's not. You can be in the private one or in the government, but you have to be in any insurance. You can't have no insurance.
So
it's not possible.
Illegal to have no health insurance.
It's not possible because if you come to Germany, that's one of the first things you have to do. You get a health insurance, and if you are living in Germany or are born in Germany, then the first thing is you get your health insurance. Yeah. It's not possible that you don't have one. There are some rare cases where people switching from private to government and from government to private, and then there's some time between it, but you can't have any health insurance. So that's a big difference to other countries where you have those opt-out models or opt-in models sometimes even. So
basically everyone in Germany has the basic treatment. That's like a very good message.
Yeah. So the basic, the government insurance isn't that bad for people who come here. But for most people in Germany, if they can change the system or if they want to choose something, most people say, okay, it's not that good. It's good for people coming here, but for us, it gets worse and worse every year. Yeah. Because it gets much, the price is rising on a significant way. The treatments you get paid are significant less. And for some treatments, like getting new teeth or if you want to have special medicine or something like this, it's new that you have to pay something on top.
Yeah, so it doesn't cover everything, right? You have to pay some parts.
It just only covers the basic thing that you can say, okay, I'm not ill anymore, or I'm not, I can work again, or something like this. But in the history, it really was that it paid everything, even the things on top. And now it barely pays the minimum because the system is really broken. Maybe some of your viewers watched the video of your pension video. Then there we talked about how the pension system in Germany works, and it's nearly the same in the health insurance system. So you had many people paying in the system, and you had a few people paying or getting paid out of the system. And that switched, of course. We have demographic change, so more elderly people and less people paying in the system, and the same is here. Yeah. So you have less people paying into the system for the health insurance, and you have more and more people getting treatments. And I don't know the exact numbers, but I think it's something like 15 million people working in Germany and paying in the system, and like
and
the rest
financing everyone.
Financing everyone.